A mouse loses the tip of a toe. You expect blood, then a scab, then a scar, the usual ending. But in a lab at Texas A&M, researchers say something else can happen. The wound doesn't just close. The tissue starts acting like it remembers how to build what's missing. Not a prosthetic, not a transplant. A biological rewind triggered, they claim, by a serum-like treatment that wakes up a dormant regeneration program in mammals. That's the headline version, amplified by coverage including futurism. The responsible version is narrower and more interesting. Scientists are trying to push mammalian healing away from scarring and toward rebuilding in a part of the body where mammals already show a small, rare ability to regrow. Before we go any further, hold on to one question. If your skin can seal a cut in days, why can't your body rebuild what it lost? In nature, true limb regeneration belongs to salamanders and axolotls. They can regrow an arm with bone, muscle, nerves, blood vessels, and skin, patterned in the right proportions. Mammals, by contrast, heal fast and hard. We clot, we inflame, we scar, and scarring is not a failure. It's an evolutionary bargain. Close the breach quickly, prevent infection, stop bleeding, survive. But that bargain comes with a cost. Scar tissue stabilizes an injury, then blocks the slow, precise choreography needed to reconstruct complex anatomy. It's the body saying, we're done here. So the real question isn't, can we regrow a limb? It's, can we convince the body not to end the story with a scar? Here's why that question isn't pure fantasy. Mammals may not have lost regeneration so much as locked it away, because there's one strange exception: digit tips. In mice, the very tip of a toe or finger can regenerate under specific conditions. In humans, clinicians have documented cases, especially in children, where a distal fingertip injury, treated conservatively, can regain skin coverage, sensation, and some bone contour. It's not a new finger. It's not a miracle. But it's a clue that the instruction manual isn't completely missing. Researchers have also pointed to the nail organ, particularly the nail bed, as a signaling hub in this process. When key structures remain intact, the body sometimes rebuilds more than you'd expect. When they don't, the default is scarring. The Texas A&M work, as described in reporting, aims to widen that narrow window. The serum framing makes the story travel fast, but it also demands careful parsing. In regenerative biology, outcomes hinge on specifics. What molecules were used, at what dose, for how long, delivered how, and in what injury model. Digit tip regeneration is a known phenomenon. The question is whether this intervention truly activates a broader latent program, or whether it amplifies a small niche of regrowth that mammals already permit. To understand what's at stake, you have to understand what happens in the first days after an injury. That's the opening act, the moment the body decides what kind of healing this will be. After tissue is damaged, the immune system floods the site with inflammatory signals. Fibroblasts move in and lay down collagen, like emergency drywall. Blood vessels remodel. The wound contracts. It's fast, robust, and usually life-saving. But regeneration, real regeneration, requires something riskier. Cells near the injury must either de-differentiate or recruit stem-like progenitors. In animals that regenerate limbs, those cells can form a structure called a blastema, a temporary, organized mass of progenitor cells that can rebuild multiple tissue types in a coordinated way. Nerves and immune cells don't just tolerate that process, they help instruct it. In mammals, inflammation often slams the door before that choreography can begin. That's why so many serious regeneration strategies focus less on growing a new limb and more on reprogramming the wound environment. Immune modulation extracellular matrix, and timing. Macrophages, for example, can push healing toward fibrotic scarring or toward regenerative remodeling depending on their state and the signals they receive. And many of the pathways researchers study, WNT, BMP, FGF, TGF-beta, are not magic switches. They're part of a dense network that tells cells when to divide, when to migrate, and what to become. So if you hear serum, don't picture a potion. Picture a carefully timed attempt to change the tone of the wound so the body doesn't default to shutdown mode. But here's the pivot that headlines often blur. Regrowing tissue is not the same as regrowing a limb. A limb isn't just bulk, it's geometry and wiring. Nerves must reconnect and provide trophic signals. Blood vessels must perfuse every layer. Bone must form with the correct length and shape. Tendons must anchor muscle. Skin must close without constricting what's underneath. And the immune system has to tolerate a prolonged construction project without flipping back into scar-first mode halfway through. Many interventions can increase cell proliferation or improve wound closure. Far fewer can rebuild a functional, patterned appendage. So the skeptical questions are not cynical. They're essential. What exactly grew back? How much? How well? Was it just more tissue or was it organized tissue? Did it restore function, not just appearance? And did the effect hold over time? Because translation is where this field breaks hearts. A digit tip is not an arm. A mouse is not a human. And a clean lab injury is not the messy reality of trauma, diabetes, infection risk, aging tissue, and uneven blood supply. Even if a treatment expands regeneration in mice, it can fail in people on fundamentals: scale, biomechanics, immune response, and the simple fact that human limbs are larger and more complex, requiring longer growth periods and more precise patterning. Still, this story grips people for a reason. It touches a fear most of us don't name until we have to. Losing function, losing independence, losing the ability to do ordinary things, buttoning a shirt, holding a cup, walking to the mailbox. Amputation is not rare, and it isn't only the result of dramatic accidents. Many amputations follow chronic disease, diabetes, and vascular disease, severe infections, cancer, sometimes after years of decline. And after it happens, life can become a long sequence of adaptations. Prosthetics, rehabilitation, pain management, phantom sensations, repeated surgeries, and the daily math of what you can and can't do. So imagine being told, even cautiously, that the body might be coaxed to rebuild instead of just cope. If a therapy could reliably shift mammalian healing away from scarring, the implications would extend far beyond limbs. Scarring is the body's compromise in many organs. After a heart attack, the heart scars. After spinal cord injury, the nervous system forms inhibitory scar tissue. After surgery, adhesions form. If that compromise can be renegotiated safely, the definition of recovery changes. But safely is the catch, and it's not a footnote. Regeneration and cancer are uncomfortable cousins. Both involve cells multiplying, migrating, changing identity, and building new tissue. Any tool that pushes growth and patterning has to prove it can stop. Cleanly, predictably, and permanently. Researchers and regulators would need rigorous animal data across species, then careful human trials, likely starting with small, controlled injuries, where risks are lower and outcomes are measurable. And even if it works, regeneration would not be instant. It would likely be slow, staged, and expensive at first, possibly requiring repeated dosing, specialized delivery materials to keep signals in place, and strict control of infection and mechanical stress during regrowth. A regrowing structure would be vulnerable tissue for months, not minutes. So what should you believe right now? Not that humans will regrow arms next year. And not that this is hype by default. The credible takeaway is more precise. Researchers may be learning how to reopen regenerative pathways in mammals in specific contexts by changing the early wound environment so the body chooses rebuilding over scarring. If that holds up under replication and peer review, and if it restores function, it would be a genuine shift. Because the real test isn't whether something grows back. It's whether it grows back correctly, wired, vascularized, strong, and usable. And that brings us back to the mouse toe. Back to that strange moment when tissue behaves like it remembers. Maybe the body isn't incapable. Maybe it's cautious, trained by evolution to prioritize survival over perfection, to seal first and never look back. If scientists can safely teach mammalian tissue to hesitate, to keep a wound open to possibility for just a little longer, then the most astonishing part won't be the regrowth itself. It will be the realization that the blueprint was there all along, dormant, waiting for the right instructions to be read again.